Non-emergency surgeries are now on hold in Clark County hospitals as the number of COVID hospitalizations breaking new pandemic records. And Wayne Haverly is digging deeper into this. I know you talked with county health officials about this latest surge. Oh, and here's the latest from Wayne.
Here in Camas, schools open up to in-person learning starting tomorrow morning. And all of this is happening as we near a projected peak in COVID cases here in Clark County. The Delta surge is doing a number on hospitals in Clark County, with intensive care units running up to 97% capacity.
We're in a tough spot. Our healthcare partners are stretched really thin. Delaying surgeries for people that are, not emergency, so that they can free up more resources. All our hospitals are doing that in Clark County.
The reopening of schools is creating a challenge for scientists and their COVID projection models. Last year, before Delta, very few kids got sick in Clark County classrooms.
So I'm, cautiously optimistic that even with Delta, which is obviously more contagious and spreads more quickly, with the masking, with the distancing in place, ventilation, all those things that schools are doing, testing to keep kids safe, I'm hopeful that we'll be able to kind of mitigate any large impacts on our case numbers from schools.
Staffing shortages are another big concern. Some healthcare providers are temporarily on the sidelines after testing positive for COVID. There's also concern over whether hospitals will lose some employees when vaccination requirements for healthcare workers go into effect. At Peace Health, that happens tomorrow.
It's not clear to me if we're going to lose a lot of people or not.
The people in the hospital vaccinated or unvaccinated?
Yeah, mostly unvaccinated. It depends, again, from day to day. It ranges from what I've seen anywhere from like 85 to 95% unvaccinated.
County health officials say vaccines remain the best weapon against COVID, and there's also growing evidence that therapeutic treatments can also help patients avoid the hospital.
The monoclonal antibodies are the ones that have gotten a lot of interest, and there's actually pretty good evidence with them now that they do prevent hospitalization.
If someone in your family does get sick, you'll want to ask about those therapeutic treatments. Also, there's concern about a growing number of breakthrough cases right now. They are relatively small, but they are happening, starting to rise in the hospitals, and they tend to be people over 65 years of age. Reporting in Camas, Wayne Haverly, KOIN 6 News.